The medical nurse is creating the care plan of an adult patient require mechanical ventilation. What nursing action is most appropriate? Option A, keep the patient in a lower Fowler position. Option B, perform tracheostomy care at bedside at least once per day. Option C, maintain continuous bed rest. Option D, monitor cuff pressure every 8 hours. So option D, monitor cuff pressure every 8 hours is correct answer. A client who has an inhalation injury comes to ER. On the initial assessment, the nurse notes that the client is very confused and physically defensive. What do you think he may be experiencing? Option A, fear. Option B, anxiety. Option C, hypoxia. Option D, pain. So option C is correct, hypoxia. The patient has vomiting that is very similar to coffee grounds. Where can the location of the bleeding be? Option A, large intestine. Option B, small intestine. Option C, upper GI tract. Option D, rectum. So option C, upper GI tract is correct answer. The peak pressure alarm is sounding on the ventilator of the client with a recent tracheostomy. What intervention should be done first? Option A, assess the client respiratory status. Option B, decrease the sensitivity of the alarm. Option C, ensure that the connecting tube is not kinked. Option D, suction the client. So option A, assess the client respiratory status is the correct answer. The nurse is caring for a patient who is ready to be weaned from the ventilator. In preparing to assist in the collaborative process of weaning the patient from a ventilator, the nurse is aware that the weaning of the patient will progress in what order? Option A, remove from the ventilator tube and then oxygen. Option B, removal from oxygen, ventilator and then tube. Option C, removal of the tube, oxygen and then ventilator. Option D, removal from oxygen, tube and then ventilator. So option A, removal from the ventilator, tube and then oxygen is correct answer. A person with a 10-year history of severe alcoholism was admitted to the ER. He got the diagnosis of acute pancreatitis. Based on the recent diagnosis, what could be the true about the patient? Option A, should be started feeding. Option B, required to be monitored for hyperglycemia. Option C, the patient is at risk for hypovolemic shock. Option D, should be placed on fluid resuscitation. So option C, the patient is at the risk for hypovolemic shock is correct answer. A patient has a diagnosis of ineffective airway clearance. He has sustained an inhalation burn injury. Among the following nursing intervention, which of the following is the most rational? Option A, ensure cuffing every 4 hours. Option B, elevate the head of the bed. Option C, monitor respiratory state and breathing every 4 hours. Option D, monitor oxygen levels every 4 hours. So option B, elevating the head of the bed is the correct answer. A patient in acute respiratory failure is receiving ACV with a positive end expiratory pressure PEEP of 10 centimeter of water. What signs alerts the nurse to undesirable effects of the increased airway and thoracic pressure? Option A, decrease BP. Option B, decrease PaO2. Option C, increase crackles. Option D, decrease spontaneous respiration. So option A is correct, decrease BP. A patient who has been admitted with a gastric ulcer now develops severe epigastric pain that spread over the entire abdomen. He is very pale and is lying on his side. What should be the nurse's immediate action? Option A, notify the doctor and check the vitals. Option B, immediately administer opioid. Option C, perform deep palpation on the abdomen. Option D, reposition the patient in semi-fowler position. So option A, notify the doctor and check the vitals is the correct answer. What type of fluid below has a low osmolarity? Option A, 0.9% normal saline. Option B, 3% saline. Option C, dextrose 5% in 0.9% normal saline. Option D, 0.45% normal saline. So option D, 0.4% normal saline is correct answer. The patient has aphasia, decreased level of consciousness and weakness in the right side of the body. There is a history of heart disease, ischemic attack and hyperlipidemia. Based on the medical history, what type of stroke could it be? Option A, hemorrhagic stroke. Option B, ischemic stroke. Option C, subarachnoid hemorrhage. Option D, intracerebral hemorrhages. So option B, ischemic stroke is the correct answer. The patient has acute liver disease. Which lab values are true with his condition? Option A, increased ammonia level. Option B, decreased PT. Option C, decreased AST and ALT. Option D, none of the above. So option A, increased ammonia levels is the correct answer. What is the fluid component that is found in certain body cavities like the spinal cord, heart, lungs and joints? Option A, intracellular component. Option B, interstitial component. Option C, intravascular component. Option D, in transcellular compartments. So option D, transcellular compartment is correct answer. Which fluid below is considered as isotonic solution but works as a hypotonic solution? Option A, dextrose 5% in water. Option B, lactated Ringer's solution. Option C, dextrose 5% in water. Option D, 0.33% normal saline. So option A, dextrose 5% in water is correct answer.